Welcome to Startup Health Now, the weekly show celebrating the healthcare transformers and changemakers reimagining healthcare. My name is Stephen Krein. I'm excited for today's episode where we're sitting down with Rob Cronin, the practice director for digital health at W2O Group, a leading marketing firm that works with digital health companies. This is going to be a great episode.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back. We're sitting here with Rob Cronin from W2O Group. Welcome, Rob.
Thank you, Steve. Good to be here.
We couldn't be more excited. We've had the privilege of getting to know you guys over the last several years.
Likewise.
You're a unique marketing agency, and also more specifically, not just working with digital health companies, but lots of traditional organizations embracing the transformation of healthcare.
Right.
Can you tell us a little bit more about what you do, and then I want to go back into your background a little, learn how you got here.
Sure. Happy to. So the agency started in 2001. Jim Weiss was the founder. And Jim was a biotech guy. He worked in corporate communications for a bunch of biotech companies. Over the years, though, as healthcare evolved, he added pharma to the picture. He added providers, payers, and then more recently, in the last several years, as an agency, we've really focused in on digital health companies. And that's when I got involved with the agency. I was hired from an in-house position with Surescripts, a digital health company, where I was working on corporate communications and marketing. And I was brought in to start a practice focused on digital health. So today, we're not only one of the largest healthcare agencies, we have a very specific focus on digital health as well.
Okay, so you mentioned Surescripts. So
Yes.
a little bit about your background. I want to
Sure.
dig into kind of what led to Surescripts and how you
Yes.
ended up becoming even passionate about and focus on healthcare in general.
So great question. So I grew up on the consulting side in the agency world. And then about 10 years ago.
As a child? That's where you...
Yes. I was reared
No,
by...
where are you from?
I'm originally from Philadelphia. And I got started my first agency job in Philly, outside of Philly, an agency called Dudnick. And that was actually my first taste of healthcare work. I had some work with Pfizer that I did in my first job there. But then I moved to New York City. And when I moved to New York, I worked for an agency called TSI that was strictly focused on tech. And for the next 10 years, I really focused on working with technology clients. And I really enjoyed that because of the innovation. And if you work in marketing and communications, you're essentially telling stories. That's your job, to come up with different ways to tell stories to whatever audiences your clients are trying to reach and engage. And in technology, things are changing so fast, and by its very definition, it is an innovative enterprise. It was really something I enjoyed a lot because the story was always changing. It was always new. So as a youngster, I had an opportunity to actually start as a copywriter. I was more on the advertising side. But I didn't like getting yelled at by the account executives on the ad side. So I noticed down the hallway that there were these people who called themselves public relations people. And that sounded interesting to me because they were not only doing creative work, they were doing the account work as well. And I said, I'd like to manage the client relationship and do the work. And so at a young age, I shifted my focus from more advertising to public relations. And that's really been my focus ever since. And so focused on technology up until around 2005. And then I went in-house at Surescripts because, as you well know, it was about that time that the federal government and a lot of different interest groups were really starting to invest heavily in health IT. Digital health was not necessarily a big term then, but health IT was really starting to be taken seriously. And the feds were doing a lot of work around standards, and eventually they got around to doing some actual underwriting of investment in health IT, specifically electronic health records, and some other areas that really help pave the way for a lot of the momentum that we're seeing today, right? So we're going in-house, my first in-house position with Surescripts, focusing on marketing and communications, was very exciting because when I got there were about 5,000 doctors in the entire United States doing e-prescribing. 5,000 out of, whatever you think the total population is. 500,000, a million. It was really
Tiny,
small.
yeah.
However, over the course of the next 7 years, I was there for 7 years, we went from 5,000 to over 500,000. And it was in the course of those events and everything we did to try and promote the adoption and successfully promote the adoption of e-prescribing, that's how I caught the bug.
Well, what was it that you did that you think contributed most to the growth of, besides time, right? It was a unique moment in time, but what helped grow from 5,000 to 500,000?
So there were a lot of different things. The government certainly played a fundamental role in organizing industry around standards, technical standards. They certainly made financial incentives available on 2 separate occasions. But aside from that, Surescripts' role was to facilitate the actual exchange of information. In this case, an electronic prescription. Today, it's much broader than that, but
how did marketing play a role in that, though?
Yes. So we tend to overlook how much education and awareness is required to get different parties in healthcare to change something they've been doing for so long, right? So in the case of writing a paper prescription, how long have doctors been doing that? 100 years maybe, longer. Depends on what history book you're reading. So that was a behavior that was very ingrained, and so the amount of educational work that we needed to do to educate doctors on simply the opportunity to do it, first of all, and then why it's beneficial, how it could help them, their patients, and the pharmacies as well certainly benefited from it. And then the kind of the mechanics of how it works, right? So there was a whole process there that was essentially a marketing function to educate them so that they could start down the adoption curve and eventually become regular users of the technology. And that's where we are today.
Right. And so did that shape your own view of how to effectively use marketing and education and probably thought leadership? Because I know that's a big strategy that you guys employ with your clients as well as with kind of your own thought leadership campaign. But I want to get into a little bit of that as it bridges to WTO Group, because I think it's interesting why they chose you to come in and lead this group. And then obviously since 2010, a lot has changed, but I'd like to talk about how that framework kind of led to you being here.
So it's a great question because early on in my work at Surescripts, it was very obvious that this was not going to be as simple as pitching the product. Just pitching e-prescribing and the technology was not going to be sufficient. You had to talk about and address some of the underlying issues that e-prescribing was meant to address.
So
right?
address the resistance.
So yes, and specifically, safety, patient safety was a big issue for a long time, and the Institute of Medicine released studies about this. Every year you had patients being victimized by poor communication in the form of bad handwriting and other problems that went along with paper prescriptions, right? So that was a major problem that e-prescribing was specifically designed to address. The inefficiency associated with a paper-based process on the doctor's side as well as the pharmacy side. That was a problem
were you actually, what were you doing to combat that, to bring some of those issues to light then? What was the platform that you used?
So it was we didn't call it at the time, but it was an integrated media campaign. So we certainly talked with the press, trade press, business press.
Traditional PR.
Traditional PR, we did a lot of that. Not only with the executives at Surescripts, but there was a community of folks, a lot of people in nonprofits, a lot of individual doctors, pharmacists, different advocates who we pulled into the public relations effort to
Sure.
really help educate through.
Was any of it innovative though, or do you, I mean, it really being critical looking back, was it innovative, and how does that play? Because I want to think about some of the challenges that healthcare transformers and the innovators that are really up against a tremendous amount, I call it molasses, to kind of get through to make sure that we can accelerate innovation. Was there innovative strategies you employed that would be applicable then to what's going on today in 2015?
Yeah, I think number one, what I was referring to a minute ago, involving a holistic set of influencers, right? You cannot change the behavior, such an ingrained behavior of such a large group in healthcare by just pitching it yourself, right? You really need to involve a lot of third parties in that. It's got to be a holistic approach. The second thing is you can't just rely on the press, right? And so with the rise of digital and social media, and with the Surescripts' particular focus on creating original content, I'll get more into that in a second, that's really where we made our breakthrough. Because you're really going to have a hard time if you're relying on the press to deliver your message all the time, right? That can be challenging. Mm-hmm. And quite frankly, with the rise of digital media and blogs specifically, and more recently social media platforms, you have the opportunity to deliver your message directly to, in this case, doctors, pharmacists, electronic health record vendors,
so control your message, publish your own, almost your own printing press.
You have to be your own best publisher. You cannot rely on third parties to publish your messages, your thoughts, and your, in this case, to really push forward the educational effort.
So now at W2O Group, it sounds like a lot of why you came here was because of what you did at Surescripts. But now, over the last 5 years, what have you built here as it relates to that strategy? And is that a big piece of the strategy that you employ not only for your clients but for those you speak with? It
is. And so what we try to do with all of our clients is to take a very integrated approach to media. So look, public relations is important and it remains important, but the fact is that there are fewer and fewer media outlets, right? The news business is a very tough business to be in right now. So, and that's not going to change. The economics of that aren't going to change. So it puts all the more importance on developing your own media channels. Again, whether it's your blog, your website, your social media channels. And the other thing that we really try and help clients embrace is identifying and engaging with influencers, those third parties who are so important to advancing whatever the conversation is and whatever the issue is that you're trying to advance. You can't do it by yourself. It's got to be a conversation. You got to involve the third parties, and it has to be the right third parties. And there's a way, we use social analytics to do this, to identify who the most influential third parties are in a particular conversation. Congratulations, you happen to be one of them in digital health. Mm-hmm. So that's a critical part as well.
So, today you've got thousands of entrepreneurs building companies in digital health all around the world. Most of them aren't hiring agencies to do their marketing. They're, in their go-to-market strategy and in their, real customer development strategy. Many of them might think of PR and marketing as a luxury. Some of them are thinking about it, but maybe only as one of the many things they do. What does the entrepreneur today building an early stage digital health company do so that they don't have to not touch it because they can't afford it or they can't focus on it, but they can do it as part of their, business development of the entire company? I'm trying to figure out how to explain, or you explain to entrepreneurs how to integrate thought leadership from the very beginning, because I know you're a big believer in it kind of being done early and often and just integrated right into the building of the business.
Well, it really starts with your investor deck, right? So every startup has an investor deck, right? That's a core set of deliverables that you need to have in order to go make your case for investment. So as part of the investor deck, that's where we often tell startups that's your first opportunity to focus on thought leadership. Because in any investor deck, you are making the case for this market that you've identified and that you're going to sell into. That market is characterized by different topics and issues and conversations, and those are the things that come together to form a position on thought leadership, right?
So what would that look? How would that show its face in the investor deck?
So there would typically be at least one slide dedicated to what your position is as a company, not only within that market, but within the conversation that you're trying to influence in that market, right? So if we go back to the Surescripts example, let's go back in the time machine, right? It would have been, the market was for electronic prescription transmission services, right? And you can have the analysis around that and who you're actually selling to. But the thought leadership position would be patient safety and efficiency within doctors' offices and pharmacies and the benefits that e-prescribing can bring there. That was more the thought leadership position that we used at Surescripts. And so any startup can really apply the same type of thinking, starting with that investor deck. And then as they go beyond that to start thinking about, okay, we need a website, we really need to make sure that we have clear brand and messaging. That's kind of the next evolution where you can build in that thought leadership position into the website, into your branding, and into your messaging.
Yeah, no, it's interesting. One of the things we spend a lot of time on is branding, brand position, thought leadership as a strategy. And it's great to hear you talk about integrating it really early on. I think when I think about how many times you need to tell your audience the same thing over and over again to drill it in, oftentimes entrepreneurs talk well past their audience, whether it's an investor, a customer, or someone they're speaking to, because they think everybody understands the lingo and understands the unique nomenclature of their operation. How do you think an entrepreneur could best get to a point where they have the right thought leadership position, or at least to get out and start playing with? I mean, what's that process look like to you?
Well, typically, the way it comes out in our work with startups is as part of a messaging session, because when you're creating a narrative for the company that you're working for, it's not just your pitch, right? The context matters, right? So we always tell clients, think of yourself at a cocktail party. That whenever you're there, whenever you're out talking anywhere to anyone about your business, picture yourself at a cocktail party. You're not going to be very successful at engaging people at a cocktail party if you're walking up to all of them and just pitching your product, right? That's boring. They're not going to care. They're not going to listen. You need context, right? You have to talk about, well, what are the issues and topics that you tie into that are relevant to something that I care about, right? So really, when it comes to establishing a thought leadership position, it starts with that core foundational messaging, and you build it into that from the get-go.
Do you test it, and how do you test? I shouldn't ask how. Do you test it? How do you test that?
So we do test it, but the great thing about using analytics now in marketing is that you can research it in advance, right?
How?
So
what's the cheap way of doing it? The hack.
Well, so that's a different topic, but there are ways to use social analytics to look at a specific audience. So say you're selling to doctors, right? Or you're trying to influence doctors. Say they're a primary influencer in the purchase decision when it comes to your product. There are ways to understand what physicians are talking about or how they're talking about a specific topic by analyzing basically the conversations that they're having online, whether it's blogs, whether it's in the news media, or especially on social media, where they are individually participating. Mm-hmm. That creates a whole data set. We for example, track the online conversations via Twitter of every physician in the United States. And so that creates a very large data set that we're then able to go in and say, for cardiovascular disease, we're able to come away using social analytics with a very clear understanding of, where are they talking about this? How are they talking about it? What are the subtopics associated with cardiovascular disease? Is it positive, negative, neutral? What drugs are they talking about, not talking about, so on and so forth.
What do you think the biggest mistakes that entrepreneurs make around marketing is today?
So I think it's still the assumption that I need to get on the cover of Fortune. That's still a wonderful goal, but it's
my father's no matter how much press or what articles are written or whatever, it's like, until we're on the cover of a print magazine that you can actually hold. Yeah.
There's still a lot of that thinking. And look, we understand that. Public relations, again, is a really valuable tool, but it's only one tool in the toolbox. And so, but I think it's over the years, entrepreneurs have just been conditioned to think PR first. I think it is changing. I think there is a growing understanding of the idea that media has changed and that there's different ways to reach an audience. So it's changing, but it's, again, we go back to these long established
So it's a mindset. You're really saying the biggest mistake they make is the mindset they have going in and thinking about marketing.
It is.
Do you have any examples that you kind of think of startups that are doing it right, that are really, they get the thought leadership platform as a strategy?
Yes, and I'll give you an example that's very timely. We just did a funding announcement with a startup called Grand Rounds. And one of the keys to not just that announcement, but the narrative that we were working on with them going into the announcement was their ability to use their own data and analytics to do research around the topics they care about. So in this case, they're very passionate and focused on assessing quality of doctors. And they do this as part of their core offering, which is to allow employees who are accessing their service through their employer-sponsored benefits program. Employees are able to get access to these physician experts around the country who Grand Rounds has identified as very high-quality physicians. And so Grand Rounds has a fascinating business model, and that's certainly front and center in the story. But what is equally fascinating and even more interesting to a lot of folks is all of the data and analysis they're doing and that they're going to be publishing when it comes to research. That's actually one of the key trends that's really emerging now from a standpoint of marketing, and specifically in digital health. The opportunity for startups who do have access to a unique data set to publish original research around that data set. And when I say research, it doesn't have to be something that appears in the New England Journal of Medicine.
Yeah. It's a great point. One of the things we've had tremendous success with is our Startup Health Insights quarterly report about all digital health funding, and we've been really it's a more comprehensive database around digital health funding, where the money's flowing, who it's flowing to, what categories or subsectors are being focused on, and watching the trends year to year. It's been a fantastic way of really penetrating beyond the traditional media coverage. So, Rob, I could talk to you for a lot longer about this, but I'm glad to have kind of kick-started this conversation. I'd love to have you back for another episode, because thought leadership, which obviously is a nice simple word, has lots of layers to it, and love to really dissect some of those for more useful kind of strategies, I think hacks around just getting a real strong thought leadership program going. But really great to spend time with you. One last question is, when you look out over the next decade and think about digital health and the transformation of healthcare, what do you think this looks like a decade from now?
Well, I'm gonna focus on an example that's very near and dear, and that is patient records. What I want to see, what I hope to see, is the fulfillment of what a lot of people in digital health have been focused on for the past 10 years, and that is that a patient's records can truly follow them around the healthcare system wherever they are accessing care. That doesn't exist today, but I believe within the next 10 years, we will get there, and we need to get there. So I'm very excited by that.
You're carrying it around in your pocket right now, maybe?
it's in a chip under
Right.
my skin.
Rob, always a pleasure. Great to
Thanks,
spend
Steve.
time. Thanks for joining us today.
My pleasure.